All right, so now we've got the patient's airway open. We've suctioned all the secretions out. You got the head in a nice, straight, open position with the tongue out of the way. So airway is clear. Let's move on to the next steps of the ABCs. Always be no, sorry, that's the office. Airway, breathing. So to breathe for a patient, we need a special device because we're not going to be doing mouth-to-mouth in a tertiary hospital, let's be honest. So we've got this device, which some of you may call an ambubag, which is the trade name for a type of this device, but the more accurate name is it's a bag valve mask. The reason, it's got a bag, a valve, so that when you pump it, air goes out, but it doesn't go back in, and a mask. Bag valve mask, really easy. So the bag valve mask is very useful because it's got a soft mask that can fit over the patient's face. Then you can position it, make a good seal, and then every time you gently squeeze the bag, you're going to be delivering high flow oxygen through into the patient's airway, and then when they breathe out the carbon dioxide, the valve is going to release that into the air. You're going to connect the bag valve mask up to the wall oxygen and turn it up all the way to the maximum, so 15 liters per minute, and then you should notice that the reservoir starts filling up, so you're going to be delivering nearly 100% FiO2 with this device. All right, so now that we know what a bag valve mask is, how do we use it? How do we hold it? And how do we apply it to the patient's face? Let's just jump over to the mannequin and I'll show you. The way the bag valve mask works is you need a good seal over the patient's mouth, otherwise you're leaking air all over the place and you're not giving a good ventilation. So, a few different ways you can grip the bag valve. I'm just going to disconnect the mask and show it on your patient's face. Ideally, if you're not experienced with airway, you should always start with a two-handed grip because it's so easy with a one-handed grip for you to have a leak. So with the two-handed technique, we're going to cover two main methods. The first method, you essentially use your hands to squish the mask onto the patient's face. First of all, we want to size the mask. So the mask should go from the nasal bridge down to that little groove below the lower lip that I don't actually remember the anatomical name for. And it should fit nicely over that. If it's too big, go for a small one because you're going to leak around the eyes. If it's too small, you're going to leak around the nose. So once you've got an adequate size mask, hopefully it fits the first time round, you want to position it as we mentioned, and then use the base fleshy part of your hand to push the mask onto the patient's face. At this point, you still don't have a good seal and it's not secure and you just want to smushing the face, which you don't want. So the next part of it is you use your fingers to wrap around the angle of the jaw and pull. So you're pushing down and pulling up. And that creates a nice seal all around because you're applying even pressure around the mask. Now push down and pull up at the jaw. So essentially what you're doing is you're giving a good seal so that you can ventilate, but also you're giving a jaw thrust, clearing the airway. Airway and breathing. Wow, I should call the module that. Anywho, that's probably the easiest method to do two-handed bag valve masking. And while you've got the mask nicely sealed around the face, someone has this connected already and is bagging the patient nice and gently, as such. In a CPR situation, you'll be giving 2 breaths every 30 compressions, so just make sure you're coordinating with the person on compressions. Other ways you can grip the mask, you can do the C&E grip, which is very handy when you're learning the single-handed technique. So we have a C, imagine a mirror image of that, and an E, again, mirror image of that. So the C goes on top of the mask, the E goes around the jaw. You can come up with some fancy memory device or mnemonic about that. So you put the C on top of the mask, with the 3 fingers in the E, similar to the other method you want to get around the jaw. Ideally, the pinky should be below the angle of the jaw. So this method might not be as useful for people with much smaller hands because they won't be able to fit around the face. And then with your other hand, you do the same thing. C on the top, E on the bottom, pinky is around the angle of the jaw. Push down the mask with the thumb and the index finger, but not too hard that you're smushing the face into a flat 2D picture. And you want to use the E to really thrust that jaw up and meet your mask. So remember, you're not pushing the mask down as much as pulling the face into the mask, also known as a face pull. So anyway, you've got a C and E in both hands, nice strong grip, jaw thrust, tongue is clear, you're able to ventilate the patient. Once you've mastered that technique, you can do a CE grip on just one hand and just put a little bit more pressure on the other side so that you've got a nice even seal, because there's nothing putting pressure here. So you just want to put extra pressure on your finger and thumb to get a good seal, and you can actually jaw thrust and bag at the same time if you're out of hands. Okay, now let's review how to use a bag valve mask and grip it properly with an actual patient scenario. Bag valve mask, oxygen gone full. Alright, so when you're ready, I can try this.
29:30.
2 breaths given. I'm going to put an OK NK in while you're doing that.
29:30.
2 breaths. One more cycle, and if it looks like we're not getting lost, I'll put an eye gel in.